What if I told you that some of the biggest threats to your absolute physical freedom, your cognitive clarity, and your long-term health after the age of 65 don't come from a sudden accident, but from routine medical recommendations that you accept without asking a single question? As we age, our bodies become more delicate in quiet, intricate ways. Our immune systems process interventions differently. Our internal organs require more time to clear standard medical treatments. And what was completely safe for a 30-year-old can carry significantly heavier consequences for a senior. Many older adults walk into clinics every single day and agree to multiple simultaneous treatments, complex prescriptions, or new clinical interventions simply because they feel rushed or assume that every standard protocol is automatically customized for their unique aging body. They don't realize that standard healthcare lines are often built for the general population, not for a highly specific, mature physiology. Today, as a medical professional, I want to pull back the curtain on senior healthcare safety. I am going to reveal 3 major clinical interventions and standard medical patterns that every single older adult must carefully question, double-check, and discuss extensively with their primary care physician before moving forward. This is not about avoiding modern medicine. It is about protecting your body from overtreatment, unnecessary drug interactions, and systemic overload. Stay with me until the very end of today's comprehensive blueprint, because our final point will reveal a critical nighttime healthcare mistake that thousands of seniors make every week that directly compromises their balance and memory. Before we break down these 3 critical healthcare shields, if you want to protect your physical autonomy, secure your long-term longevity, and manage your health on your own terms, please click that subscribe button below and turn on the notification bell so you never miss another Senior Health Masterclass here on the Dr. Robert channel. If you are ready to fortify your medical awareness and take active, calculated control of your health journey today, please type 1 in the comment section right now. If not, drop a 0 so I can learn how to optimize these clinical guides for your specific needs. Let's analyze the baseline physiology of aging, clinically known as immunosenescence. As your body crosses the 60 and 70-year milestones, your cellular infrastructure naturally undergoes structural remodeling. Your bone marrow produces fewer naive T cells, your lymphatic drainage system slows down, and your liver and kidneys take significantly longer to filter out metabolic compounds. This means that when you introduce any external substance into your system, whether it is a heavy prescription medication, an aggressive over-the-counter anti-inflammatory pill, or multiple simultaneous clinical interventions, your body's threshold for tolerance is entirely different than it was a few decades ago. Think of your aging body exactly like a beautiful, classic vintage automobile. It can still run perfectly, cover long distances, and navigate real-world paths with absolute grace. However, you cannot pull into a standard service station and use aggressive, modern, high-pressure diagnostic treatments meant for a brand-new vehicle without risking damage to the delicate internal wiring. You must treat your system with precision, caution, and individualized care. Let's break down the 3 critical areas where older adults must slow down, ask deep questions, and demand personalized clinical adjustments before agreeing to standard automated procedures. Shield 1. The trap of polypharmacy and cumulative drug cascades. This is the #1 medical vulnerability facing seniors today. It occurs when an older adult is prescribed multiple medications by different specialists, resulting in a dangerous chemical gridlock inside the body. The danger. One doctor prescribes a drug for your blood pressure. That drug causes a subtle side effect, like mild ankle swelling or an upset stomach. Instead of evaluating the drug, another specialist prescribes a second medication to treat that specific side effect. This creates a cascade where you are taking pills to fix the problems caused by other pills, overloading your liver and spiking your fall risk. The doctor's rule. Once every 6 months, pack every single one of your prescriptions, over-the-counter supplements, and vitamins into a bag. Sit down with your primary care provider for a dedicated medication clean-out review. Ask this direct question for every item. Is this specific compound still absolutely necessary for my current physiological status, and does it conflict with anything else I am taking? Shield 2, unmanaged vaccine and immune timing overload. While immunizations are completely vital for defending senior populations against severe respiratory and viral diseases, the clinical timing and compounding of these treatments must be handled with high precision. The danger: walking into a commercial pharmacy and receiving 3 heavy, high-dose adult immunizations, such as the flu shot, the shingles vaccine, and a pneumonia treatment, all on the exact same afternoon. While convenient, loading multiple heavy immune-stimulating interventions simultaneously can trigger severe systemic inflammation, prolonged fatigue, joint aches, and temporary confusion in an older body. The doctor's rule: space out your major clinical immunizations by at least 2 to 4 weeks. This gives your delicate immune system ample space to build target antibodies effectively, without draining your systemic energy reserves or triggering an inflammatory overload. Always ask for the preservative-free, single-dose options whenever available. Shield 3. The routine overprescription of chronic sleep aids. Millions of older adults struggle with changing sleep architectures after age 65. Because deep sleep cycles naturally shorten, many seniors turn to prescription sedatives or over-the-counter nighttime sleep aids containing heavy antihistamines. The danger: these chemical compounds linger in a mature bloodstream for up to 18 hours. When you wake up at 2 a.m. to use the bathroom, your brain is in a state of chemical fog, your blood pressure fails to adapt quickly, and your leg muscles lack coordination. This is the exact mechanical trigger behind some of the most catastrophic nighttime senior falls and progressive memory complaints that mimic dementia. The doctor's rule: completely avoid long-term use of sedating antihistamines or heavy chemical sleep agents. Focus instead on natural circadian alignment. Maximize your exposure to natural sunlight before noon. Stop consuming liquids 2 hours before bed. Use low-profile nightlights along your bathroom path, and discuss safe, non-sedating behavioral strategies with your physician. Protecting your physical longevity requires a continuous balance between advanced modern medical science and defensive, calculated daily living habits. There is zero weakness in pausing, taking a deep breath, and saying to a medical provider, "I want to fully understand the risks, the alternatives, and the exact reason why this intervention is tailored specifically for my body before I give my consent." Your daily home health habits dictate your actual quality of life. Ensure you are moving your body gently every hour to support natural vascular clearing, drinking sufficient fresh water within your doctor's structural parameters to help your kidneys filter out waste, tracking your baseline vitals in a quiet notebook, and checking your feet daily for changes. Doctor's essential safety reminder: if you ever experience sudden, unusual changes in your speech, a dramatic weakness localized on one side of your body, sudden chest tightness, or a rapid, painful swelling in a single leg, do not wait. Seek immediate emergency professional clinical evaluation right away, as early action saves lives. Your future physical health and autonomy are not built through passive compliance. They are constructed through small, repeatable, informed choices. By taking control of your medication lists, spacing out your immune treatments, and protecting your mind from heavy nighttime sedatives, you are directly reinforcing the freedom, dignity, and longevity you rightfully deserve. Please take a brief moment right now to comment below with your age and share one healthcare question you plan to ask your doctor during your very next appointment. Click that like button, share this vital safety guide with a contemporary who wants to stay informed, and subscribe to Dr. Robert to protect your longevity journey. Thank you so much for watching. Keep your health framework safe, and I will see you in our next video.